So this morning, Dr. Sandy Feldman joins us with what we should be aware of. Dr. Feldman, good morning, and thank you for being here.
Good morning. It's a pleasure to be here today.
For years, I would make fun of my mom. She would look at the paper and always pull it back, and I'm like, oh, look at you. You can't look at your paper. She's like, honey, just wait. Just wait. There's going to be a time that your eyesight's going to go too, and I start to feel now that I'm in my late 30s, it's starting to happen. When should people start checking their eyes?
Well, we should start even as children checking our eyes, but as children, every other year is adequate until the age of about 40. As we age, more diseases of our eyes can come, so every year eye exams is important.
What is, for those that may not know, macular degeneration and glaucoma? What are those exactly?
Well, those are two of the most devastating eye diseases that occur, especially during the aging process. In glaucoma, it's a disease where the pressure inside our eye is high, and it can lead to damage of the nerve in the back of our eye. Now, what happens in glaucoma is that one develops a tunnel vision, and they begin to see kind of black on the side. You would just see someone's face, and it's a very, very slow process. So you don't know you have the disease often until it's too late. For macular degeneration, it's kind of the opposite problem. It affects the center of our sight, the area of the finest visual acuity. So if you're looking at a person's face, what you would end up seeing is kind of their hair, but you would be missing their face. And clearly, these are two problems which we don't want to have happen to us.
So besides just seeing things differently, are there any other symptoms with these two particular ones that you're talking about, or is it just a change in what you're seeing and what you're looking at?
Well, actually, with both of these diseases, by the time you notice that you've got them, it's often too late.
What?
Because once you've got the damage, you can't really reverse it.
So what do you do?
So the important thing is to try to prevent it and make healthy choices in your lifestyle to prevent it. Things such as controlling our blood pressure, our cholesterol, not smoking, being inactive. So exercise has been shown to affect our blood flow, our blood vessels, and actually impact these diseases.
There's also something that you're going to talk about. It's called the Amsler Grid Test. This is something that we can do, or our friends at home can do. What is this exactly? How do we do this?
Well, what an Amsler Grid Test is, it's a little grid, and you look at the center dot.
Okay, which center dot?
The very dot in the center of all those lines.
The left side, right?
You would cover each eye and do one eye at a time.
One eye at a time.
And you want to make sure that those lines are straight, not wavy.
Okay.
You don't have any missing pieces in there. That's an early detection test for macular degeneration.
Oh, wow. And then what on the right-hand side, that's what it would look like for somebody that has maybe one of those diseases?
Exactly.
Okay.
So if you have macular degeneration, that's what it would look like to you. So you could tell that would affect how you're reading and what you're seeing on a daily basis. Again, you want to try to prevent these to the extent that you can.
All right, Dr. Feldman, thank you for stopping by and chatting with us. Good information here. It'll get us thinking about our eyes. Thank you.
You're welcome.